Welcome to the next lesson in the First Aid, CPR, and AED unit. In this lesson, we will talk about infant CPR, as well as how to respond to choking emergencies. Please watch this video, which is a visual representation of how to perform infant CPR. There are several differences between infant CPR and child and adult CPR. One of these is how we check for responsiveness. With an infant, we want to tap the baby's foot instead of the shoulder to elicit a response. For compressions, instead of using the heel of the hand on the center of the chest, we want to use two fingers, either the forefinger and the middle finger or the middle finger and the ring finger. We also want to compress about 1.5 inches instead of 2 inches for an adult, so not as far down into the chest. If you are alone when a cardiac emergency with an infant occurs, instead of calling 911 first, you want to perform 5 cycles of CPR, compressions, and breaths. Hands-only CPR is not recommended for infants, before actually calling 911. In addition, when performing those rescue breaths, instead of pinching the nose and covering the mouth with your own mouth or breathing device, you want to cover both the infant's mouth and nose at once. Regardless of age, compressions are given at a rate of 100 to 120 beats per minute. Again, this is the same beats per minute that is in the song I Will Survive, Stayin' Alive, or Crazy in Love. The differences between infant, child, and adult compressions can be seen on the screen. For infants, you want to use 2 fingers in the center of the chest, compressing about 1.5 inches into the chest. For a child, you want to use 1 or 2 hands in the center of the chest, compressing about 2 inches. And for an adult, you want to use 2 hands in the center of the chest, compressing about 2 inches. The steps for infant CPR are as follows. Step 1, check if the scene is safe. Make sure that it is safe to enter in order to give CPR to that infant. Step 2, tap the foot and shout, "Are you okay?" Yell if no response is elicited. Step 3, if someone is there, tell them to call 911 and get an AED. If you are by yourself and not near a phone, do 5 cycles of CPR first before stopping to call 911. Step 4 involves opening that airway. We need to tilt the head and lift the chin in order to open the airway and check for breathing. If the infant is not breathing, you need to perform 2 rescue breaths. Use your mouth to make a complete seal over the infant's mouth and nose, and then blow in for 1 second to make the chest clearly rise. Now deliver 2 rescue breaths. If the infant is unresponsive to those rescue breaths, begin CPR with 30 compressions within 10 seconds of collapse, followed by 2 rescue breaths. If an AED is available, turn it on and follow the directions. Lastly, continue with the CPR cycle until EMS arrives, or if you see obvious signs of life, like breathing, or typically an infant will start crying. If another responder is available, take turns giving compressions and breaths every 2 minutes, or every 5 cycles of CPR, spending no more than 10 seconds switching roles. Now let's move on to responding to choking emergencies. Choking is one of the leading causes of unintentional deaths for infants. Children ages 4 and under, especially children under the age of 1, are at a great risk for airway obstruction injuries. The majority of choking-related incidents in children are caused by food, coins, and toys. On average, a child in the U.S. will die every 5 days from choking on food. This video will go over how to respond to an infant that is having a choking emergency. The following are the steps to responding to an infant that is choking. Step 1, check if the scene is safe. Step 2, if the infant is not breathing or is turning blue, give 5 back blows between the shoulder blades, followed by 5 chest thrusts in the center of the chest. Continue rotating sets of 5 back blows and 5 chest thrusts until the object is removed or the infant becomes unconscious. If the object does not come out and the infant is unconscious, activate EMS by calling 911. Then begin CPR, beginning with compressions and looking for the object in the mouth before giving the breaths. The universal sign for an adult choking is 2 hands around the neck. If a choking person is coughing, let them continue to cough and verbally encourage them to cough. If they get up and leave the room, follow them because choking can quickly become a life-threatening situation. If they stop coughing, take action quickly. Ask if you can help. Tell them you're trained in first aid, and if they cannot speak or cough, you will need to intervene. This video highlights the steps one should take when responding to an adult who is choking. The following are the steps for responding to a choking adult or child. After checking the scene for safety and the injured or ill person, have someone call 911 and get consent. For children and infants, get consent from parents or guardians if they are present. After gaining consent, give 5 back blows followed by 5 abdominal thrusts by positioning the adult or child in the position shown on the screen. When giving the abdominal thrusts, you want to place your fist in the center of the abdomen just above the navel. Repeat alternating between 5 back blows and 5 abdominal thrusts until the object is forced out, the person can cough or forcefully or breathe, or the person becomes unconscious. If the person becomes unconscious, carefully lower them to the ground and give care for unconscious choking, beginning with looking for an object. Make sure 911 has been called at this point. While responding to a choking child is the same as an adult, there is one difference. With a child, because of their height, you may need to kneel behind them in order for you to be at the correct height to provide effective abdominal thrusts. Other special considerations with choking emergencies include if you are by yourself, you can use a chair to deliver abdominal thrusts. In addition, if you are unable to reach around someone's waist to perform the abdominal thrusts, or if a woman is pregnant, give thrust at the chest instead of at the abdomen, like is shown in the image on the screen. This is the end of infant CPR and choking emergencies. Please go to the First Aid, CPR, and AED folder and take the quiz.